Ankylosing spondylitis' definition. Ankylosing spondylitis is a chronic, progressive, seronegative spondyloarthropathy that primarily affects the axial skeleton, spine and sacroiliac joints, leading to inflammation, fibrosis, and eventual fusion ankylosis of the vertebrae. Etiopathogenesis. Strong genetic association with HLA-B7 antigen. Approximately 90% of us patients. Chronic inflammation gives erosion of cartilage, and bone gives new bone formation, gives fusion of vertebrae, bamboo spine. Emphysematous inflammation at tendon, ligament insertion sites is a key feature. Clinical features. 1. Axial symptoms: spine and sacroiliac joints, chronic low back pain and stiffness greater than 3 months. Morning stiffness greater than 30 minutes, improves with activity. Loss of spinal mobility, reduced lumbar flexion and chest expansion. Progressive kyphosis gives stoop posture in late stages. 2. Peripheral joint involvement. Asymmetric oligoarthritis, mostly lower limb joints. Heel pain, Achilles tendonitis, plantar fasciitis. 3. Extra-articular manifestations. Acute anterior uveitis, most common, unilateral eye pain, redness, photophobia. Aortic regurgitation, conduction defects, cardiac involvement. Restrictive lung disease due to costovertebral joint involvement. Inflammatory bowel disease, IBD association. Diagnosis. 1. Clinical criteria. Low back pain greater than 3 months, improving with exercise, not rest. Limited lumbar motion. Reduced chest expansion. 2. Laboratory tests. HLA-B7 positive, but not diagnostic. Elevated ESRCP inflammation markers. Rheumatoid factor F and anti-CCP negative, seronegative arthritis. 3. Imaging. X-ray of the sacroiliac joint, early sign, shows bilateral sacroiliitis. X-ray of the spine, late sign, shows bamboo spine appearance, syndesmophyte formation, vertebral fusion. MRI early detection shows active sacroiliitis. Management. 1. Medical treatment. NSAIDs first line. Indomethacin, naproxen reduce pain and stiffness. TNF-alpha inhibitors for severe cases. Infliximab, etanercept, adalimumab. IL-17 inhibitors. Secukinumab for refractory cases. Diamide-sulfasolazine, methotrexate, used for peripheral joint involvement, not effective for axial symptoms. 2. Non-pharmacologic management. Regular physiotherapy and exercise maintains spinal mobility. Posture training to prevent kyphosis. Swimming is highly beneficial. 3. Surgical treatment. Hip replacement in severe hip involvement. Spinal surgery, osteotomy for severe deformity. Complications: spinal fractures due to rigidity and osteoporosis. Atlantoaxial subluxation, rare but serious. Restrictive lung disease due to ribcage fusion. Aortic regurgitation and conduction abnormalities, cardiac involvement.